Record rains have left Delhi NCR battling a mosquito crisis, with dengue and malaria cases spiking early this year. Stay safe with timely symptoms and prevention tips. This year's monsoon has done more than cool the summer heat. Large areas of Delhi NCR have turned into mosquito breeding grounds, thanks to heavy rains. The result an alarming and early rise in vector-borne diseases. Hospitals are already reporting higher than usual cases of dengue, malaria, and chikungunya for this time of the year. In August 2025 alone, Delhi recorded 286.7 millimeters of rain, nearly 25 above the monthly normal. With more showers expected, the total is set to cross 300 millimeters, leaving the capital with a clear surplus this monsoon. Countless pools of stagnant water now act as perfect nurseries for mosquito larvae, fueling faster case growth compared to previous years. Dr. Rajesh Kumar Budiraja, Director Internal Medicine, Fortis Faridabad, shared his inputs on the subject. By the end of July, dengue cases had already reached 277, among the highest mid-year tallies in the past 5 years. Just 3 weeks later, the number crossed 350, with hospitals admitting nearly 24 new patients each week. To compare, last year ended with over 10,585 dengue cases and 11 deaths. Also read dengue fever. Doctor shares why more adults are now landing in ICUs with the mosquito-borne disease. Malaria, too, is resurging at a worrying pace. With 124 confirmed cases by late July, the count has already exceeded the total reported last year. Health officials say this is the sharpest rise in nearly a decade at this stage of the monsoon. Also read malaria in children, why kids are more vulnerable and how to protect them. Although chikungunya cases remain relatively low at 17, experts warn of its potential to flare up in the coming weeks. Municipal reports show the gravity of the situation. In just 1 week of July, more than 9,100 mosquito larva positive sites were found across the city. Also read chikungunya during monsoon. Can this mosquito-borne disease lead to arthritis? Expert explains. Doctors stress that recognizing symptoms early can save lives. Doctors advise immediate hospitalization if patients show persistent vomiting, stomach pain, bleeding, breathlessness, or sudden confusion. Prevention remains the strongest defense. Experts recommend the rise in mosquito-borne diseases highlights how shifting weather patterns are reshaping public health. Unpredictable and intense rains are no longer just seasonal nuisances, they are breeding grounds for outbreaks. With more rain forecast in September, experts warn of another surge in cases. But awareness, preventive measures, and timely diagnosis can ease the burden on hospitals.